I am so humbled by the trust and confidence of the Morehouse School of Medicine Board of Trustees for this honor, and I say thank you very much. I appreciate the opportunity today to stand under the shade of a tree that I did not plant. This honored and sacred ground was nurtured and cultivated by many who came before me. Those like former Morehouse School of Medicine presidents Louis Sullivan, James Goodman, James Gavin III, David Satcher, and John Maupin. They nourished and nurtured this medical meadowland, and for them I say thank you for your contributions to the School of Medicine and for their legacy of fervent leadership. To my teachers, Mrs. Newbold, Mrs. Fairclough, Mrs. Ella Mae Carter, who I see sitting on the edge, who taught me to love Shakespeare. Mr. Charles Cook, I hope you're here somewhere. Just to name a few, who brought science alive for me in the classroom. And they taught me to love the role it could play in my life and the lives of others. It was their early introduction to the wonder of science and discovery and Shakespeare that engaged me and intrigued me as a student. To my mother, whose sage advice she told me a lot of things, but she told me that as a young physician, the most important thing was going to be that I value my patients. And I make sure that my counsel always considered what was in their best interest first. To my family and friends who are here today, I want to thank you so much for your encouragement, your wisdom, your unwavering support. In particular, my three sisters, Marcia, Sandra, and Priscilla, and their families, my sister-in-law, Brenda, and her family, my supportive husband, Melvin Jr., and my two wonderful children, Jane and Melvin III. And yes, happy birthday, Melvin III. Thank you for sharing your birthday today with Mommy. I appreciate it. I would ask that my immediate family and all of my extended family please stand and take a moment. Please stand. My Aunt Carter Ruth and Aunt Pauline are raising their hands because they didn't want to stand. Okay, I got you. I got you. You're too young to stand. I know Aunt Pauline. To my sorors of Delta Sigma Theta Sorority Incorporated, my Link sisters, and my dear friends who have supported me through tears, love, and laughter, I said thank you for adding to the richness of my life. Thank you to the platform guests who have impacted my life in so many ways, shepherding me toward this day. And I want to extend a special thank you to Dr. Robert Franklin for presiding over this investiture ceremony. Well, you see, Robert and Cheryl and I have been friends with Melvin and me since our early days at Harvard. We've shared so many memories together, the birth of our children, the christening of Jane at Danforth Chapel, and many vacations that we now get to take with each other, childless. And so I could think of no other person whom I would want to open this occasion at this historic place and at this time other than Robert Franklin. Thank you. To the legislators, federal, state, and local officials who are present, to my other AU Center presidents, thank you for welcoming me. To the faculty and staff at Morehouse School of Medicine, who are the backbone of Morehouse School of Medicine, and who tirelessly prepare and inspire our important asset, our students. Would you all please stand, the faculty, the staff, and the students, and be recognized once again. And finally, to our alumni, who extend our reputation of excellence well beyond our physical boundaries to this broader community. So we're all alumni of Morehouse School of Medicine. Please stand and let me applaud you, please. Please stand. I too am reminded, as many of you are, of the significance of September 11th in our country's history, and ask that we remember those whose sacrifice affords us the right to bask today in the privilege of freedom. Today we are gathered in the chapel that bears the name of a man who emphatically understood the moral obligation of equality in America. Martin Luther King Jr. once said, "Of all the forms of inequality, injustice in health care is the most shocking and inhumane." What we now know after many years of study and documentation is that injustice in health care extends well beyond access to health care. The injustice is evident in how health care is delivered, whom it is delivered to, and where it is delivered. If we are to act upon what we have learned and what we know, we must act differently. We must move our discussion from simply cataloging health disparities to one that builds upon our new knowledge and leads to health equity. For you see, health equity is not defined by giving everyone the same level of service or access, but by giving a person or a community the level of service and access to resources that allows a person or that community to reach an optimum level of health. The elimination of health disparities is one of the pillars on which Morehouse School of Medicine was built. Today, our charge, though, is to become a leader in closing the health gap. But how? That is our charge. This is our 21st century mission. We will become the recognized leader in the creation of health equity. Let me say that again. We will become the recognized leader in the creation of health equity. And we will do this by focusing on 4 key areas. First, how we educate our learners and who we educate. Over the past 39 years, we have graduated more than 2,000 physicians, public health professionals, and biomedical scientists. Many have chosen to practice primary care medicine, or they have advocated on behalf of those in underserved communities. That is the reason the Josiah Macy Jr. Foundation ranked Morehouse School of Medicine the #1 medical school in the country in fulfilling its social mission. America will face a physician shortage of more than 90,000 doctors in 10 years. By 2020, this country will face a serious shortage of both primary care and other medical specialties to care for an aging and growing population. Proudly this year, we enrolled our largest class of 78 MD students, and we will focus on expanding to 100 medical students with a 20% increase in biomedical and public health students by 2017. Continuing to increase the number of mission-conscious healthcare professionals will, though, require enhanced recruiting efforts and innovative medical education programs. It will include training compassionate professionals who are committed to the holistic treatment of patients and not just their medical condition. Our recruiting efforts must include cognitive diversity in the selection of those who are admitted here. Scott E. Page is a social scientist who has written extensively on the power of diversity in creating stronger teams. He says that there's an empirical evidence that the greater the diversity, the more productive the team. And since 70% of our physicians come from underserved communities and choose to practice in underserved communities, it is critical that we channel their life experience and their diversity to make sure that we maintain innovative academic programs that will broaden their experience and exposure to new ideas. We must create opportunities to enhance their experience by including training at the Veterans Administration Hospital and at private hospital systems like Atlanta Medical Center, and global health experiences like those with our partner, the Fogarty Foundation. This strategy, though, of identifying these most cognitively diverse learners is not limited to our recruitment of medical students. It expands also to our biomedical scientists and our public health students, for we know that our success in creating health equity is highly dependent on evidence-based science that begins with research discoveries that incubate in the lab, but only become real to the public when they're extended through the advocacy of public leaders. Second, we must continue to engage and educate the community. One of our core community values is that the community has the right to participate as an equal partner at every level of decision-making, including assessment, planning, implementation, enforcement, and evaluation. A person's access, you all, to quality health services has a profound effect on every aspect of his or her life. Yet nearly 1 in 4 Americans do not have a primary care provider, and people without medical insurance are more likely to skip routine medical care that increases their risk for more serious conditions. We can thank the Obama administration for the Affordable Care Act. The Affordable Care Act has improved access to quality care, and it makes health care coverage possible for many Americans in order to reduce disparities in health care. But it doesn't end there. The president has proposed $14.6 billion for health care training in his 2015 budget. It also includes more than $5 billion over 10 years to train 13,000 doctors to serve in underserved areas. His budget also proposes $4 billion over 6 years for medical students to receive scholarships and loan repayment assistance in return for serving in those communities. It doesn't just stop at the training. He's also expected to seek more than $5 billion in increased payments to providers who serve Medicaid patients. Increasing access to routine health services and health insurance are vital for improving the health of not just minority communities, but all communities. Now, at Morehouse School of Medicine, we understand that health status and health behaviors are determined by personal, institutional, environmental, and policy influences. Educational and community-based programs over the next decade will be the key to improving health outcomes in the United States. We at Morehouse School of Medicine recognized years ago, though, that those educational and community-based programs can't just be at the hospital. We got to reach out to people outside of the traditional healthcare facilities. That is why we have trained over 75 community-based physicians to participate in clinical research, and why we have one of the first mobile research vans that actually goes into the community. Our community engagement is broad, and it is comprehensive, and it's sustainable, just like the community voices under the Satcher Health Leadership Institute that addresses prison health and reentry support programs. They address obesity. They look at diabetes prevention programs. They think about the mental and behavioral health that everyone needs to have in order to get rid of their challenges with disparities. We are seeking, though, to expand our public and private partnerships that create win-win scenarios to improve patient outcomes, like our eHealth Strides initiative. With investments and collaborations from Microsoft and the NIH, we launched a disease management system called eHealthy Strides. It empowers patients to take an active role in managing their diabetes with support from real-time healthcare providers. It has helped us to recognize the importance of individualized health risk assessments and to develop a preventive, personalized, and participatory treatment plan for the patient. We're so excited that the eHealth Strides has been tested in approximately 300 diabetic patients, including the members of the Big Bethel AME Church and in primary care practices across the city. The City of Atlanta Human Resources Program recently started providing incentives for employees with diabetes to use eHealth Strides to achieve health and wellness goals. These type of strategies, designed in collaboration with the community, are our best chance at creating win-win health strategies that benefit not just the minority community, but all of our communities. Third, we must integrate and partner with systems committed to health equity. It would be impossible for Morehouse School of Medicine to fulfill its social mission without its deep roots and partnerships. In order for us to amplify our aspirations, we must have partners who are as passionate as we are and who recognize the investments in people, processes, and technology. These partnerships may include health systems, companies, families, advocates, other healthcare professionals, educators, social workers, volunteer organizations, and yes, the state of Georgia. We don't have to look far to find partners who share our collective vision, partners like Emory University School of Medicine. For it was Emory University School of Medicine that stepped in during the early days of Morehouse School of Medicine's transition to a four-year medical school. The bonds formed by that early partnership are even stronger now as we partner in research through our ATCSI grant and with my alma mater, Georgia Tech. We also work side by side with Emory at what I believe is the best teaching hospital in America, Grady Memorial Hospital. Now, I know it changed its name. Now it's something fancy like Grady Hospital, but for us, it was known as the Grady. For it was at the Grady that I, as an Emory resident, that I spent my formative years honing my skills in obstetrics and gynecology. It was through the lives, though, of those courageous patients that I learned the real meaning of humility. It was there that I began to understand why my seventh grade teacher, Miss Betty Davis, made me say the word humble over and over and over again as I practiced my valedictorian speech until I said it with humility. The character of a person is tested when they find themselves vulnerable to a system or a person who can determine a particular outcome in their life. The humility in which a physician engages with patients can either rob them of their dignity or elevate their spirit of hope. We value our relationships with federal agencies like our friends and colleagues at the CDC and the NIH, and yes, we are there side by side at the Atlanta VA Medical Center. Don't listen to the hype. We care about our veterans. We take care of our veterans. Our class expansion, though, is predicated on continuing to identify students who are committed to primary care and those critical core specialties that impact the daily lives of the most vulnerable. However, they must be prepared. And we believe that the best way to prepare a workforce is to invest in children. My life is a clear example of what happens when you invest in a child. The odds were not in my favor. A single-parent household, a high school educated mother, working in a paper factory, and all of my siblings less than 3 years apart. But the Georgia public school system was my lifeline. And I believe it can be the same lifeline for many other Georgia children who have a curiosity for knowledge. That's why we want to advance our partnership with Georgia Public School Systems, assisting in the advancing of STEAM, science, technology, engineering, arts, and math. We want to partner with companies like Georgia Power and with this workforce development programs, creating the next generation of healthcare professionals begins with stimulating a passion for learning and a hunger for discovery in young kids. Some of those kids will become technicians. Some will become nurses. Some will become Morehouse School of Medicine students, and some will choose to work at places like Georgia Craft Paper Factory. But they'll do it because we partnered together and we invested in them and we invested in their shared vision. And for those students, though, who come to Morehouse School of Medicine for medical school or residency training or to get their PhD or to get their master's, we'll continue to show the state the return on investment, the return that we give for the state operating grant investment they give to us. Because 60% of our graduates practice in Georgia, and more than 65% of them continue to choose primary care or core needs specialty. So I said thank you to the governor. I said thank you to the Georgia legislature for supporting our mission through a state operating grant that allows us to educate and train professionals who are standing and leading, not just in the elimination of healthcare disparities, but in the creation of health equity. And last but not least, research. Great research makes for a great medical institution. Research programs can provide the basis for innovative models for teaching, for community partnerships, all of which are essential to meeting the health challenges of the 21st century. We all understand, though, that resources are limited, and medical schools have to focus their research and closely align it with their mission. Well, that's good news for us at Morehouse School of Medicine because we've been doing that for a very long time. We've seen success in our nationally recognized neuroscience and cardiovascular research program. And in the last 5 years, we've concentrated our research in 4 key areas: cancer, cardiovascular disease, neurological disease, and infectious disease. And you may say, why? We know that these diseases have the highest rates of disparity for the communities that we care about. And by making an impact in those areas, we can begin to level the playing field, creating health equity across the board. We must, though, continue to produce groundbreaking research combined with innovation if we are to make that research translational. Let me give you just 2 examples of the kind of translational research we are doing to fight health disparities and create health equity. Our National Center for Primary Care Research team is working with the Amgen Foundation, and we have identified some communities that have moved from high disparity to high equity outcomes in breast and colorectal cancer. Specifically, we have evaluated breast cancer mortality trends over the last 20 years in all of the counties across the nation with sufficient numbers to create stable rates. These counties began the 20-year time period with substantial black-white disparities. but convergence of the mortality trend lines now show outcomes or can be optimal and equitable. This research shows that disparities are not inevitable, and that in some high disparity communities, we can begin to see a path toward health equity. Secondly, the National Center for Primary Care published a paper in 2010 that really supports the way we are now articulating the mission, the balanced mission of Morehouse School of Medicine. We documented that most of America's success stories in health in the last 50 years did not just come from public health or just medical care or even social determinants, but instead came from the combined efforts of research innovation, public health, and medical care, especially primary care, but also subspecialty care. The specifics of the study showed that 9 conditions with mortality rates high enough to appear on the leading causes of death in the United States over the last 50 years have achieved at least a 50% reduction in mortality from their peak from 1950 to 2000. 7 of the 9 conditions required, though, all 3 elements of the triangulation model: research innovation, public health, health promotion, primary care, to achieve that success. The success stories typically consisted of a research innovation. For example, the invention of the Pap smear. It diffused throughout the dual channels of public health. For example, promoting screenings for cervical cancer, and then medical care. For example, primary care, delivering most Pap smears, and specialty care doing the colposcopy or the biopsy and the treatment. We noted that most often the dual channels of public health and the medical care workforce have to be in parallel and then in partnership. But we don't always do a great job, and so we know we need more integration. A cautionary note: unequal diffusion of new life-saving treatments, though, can sometimes worsen the disparities between the most advantaged and the less advantaged, as what we have seen in antiretroviral treatment of HIV, unless we pay attention to equity. And this is why the world needs Morehouse School of Medicine. Because we know how to pay attention to those signals, to those elements that can cause us to see the divergence instead of the convergence. Benjamin Franklin said, "Justice will not be served until those who are unaffected are as outraged as those who are." It is not unconscionable to question cost and quality of care in this new healthcare environment. Cost is a reasonable qualifier, but our moral challenge is to be impassioned enough to be outraged by the enormous equity gap between the haves and the have-nots. At Morehouse School of Medicine, we have always known and believed that addressing health needs is a moral obligation, because health is essential to our existence and to our quality of life, and there is no moral ambiguity in our responsibility to humanity. My hope for healthcare equity in this country, though, will not be accomplished by my vision alone or by my will alone. So although my greeters put me on a platform, I have to have some people to help hold me up. This great and historic institution can be the catalyst that activates, though, my vision and my will. Our greatest asset lies in the professionals we train, those 129 students who got their white coats or got their pens today. It is those students whose care and commitment illuminate our highest calling: knowledge, wisdom, excellence, and service. For they are the tenets that will propel us from good to great. However, one of the challenges we face in moving from good to great is the financial realities that exist in higher education. The cost of professional and graduate medical education is high, and our students often carry extremely significant debt upon earning their degrees. Our profound challenge is to raise money and increase our endowment to provide more scholarships for our students. Now, granted, fundraising is not easy. However, I am confident that in order to raise the standard of excellence in fundraising, we must provide current and potential investors with opportunities to share in our success and our pride, because I know they want to support us. Simple things such as consistently sharing the stories of our success and our challenges, and then inviting our partners to join us in creating the solutions. We have to inform them honestly and transparently about our circumstances and let them know when giving and how they're giving makes a difference between failure and success. As you know, I have been extremely vocal about this inauguration, focusing on raising money for scholarships to support our students so that we could decrease the debt they incur to attend Morehouse School of Medicine. But you see, our students, on average, come from families with household incomes of $45,000, whereas the average medical student in this country comes from a family household income of $175,000. So we ask hundreds of alumni and friends to join us in raising $1.5 million for the Presidential Scholarship Initiative. You listened, you heard me, and I am so proud to announce that you answered the call. You stepped up, and today we have raised $2.76366 million. Your gifts, your pledges to the Presidential Scholarship Initiative are going to make such a difference in the lives of our students. Students, please rise and thank those donors for thinking and caring about you. Maya Angelou once said, "I would like to be known as an intelligent woman, a courageous woman, a loving woman, a woman who teaches by being." You have my abiding and enduring allegiance that I am prepared for this and will steer this ship under my watch with grace. We are partners in this new exciting venture, and I am honored to be at the helm as we journey together in pursuit of excellence. Thank you all very much.